The rising cost of living in Hawaii is doing more than straining household budgets. It's creating a mental health crisis, particularly among working adults who are struggling to afford basic necessities. A new study from the University of Hawaii, Manoa, reveals that food insecurity is the strongest predictor of poor mental health in the state, surpassing even other socioeconomic stressors. The reality of not knowing where the next meal will come from is directly linked to increased rates of depression, low self-esteem, and suicidal thoughts. For many residents, it's not just about affording food. It's about the emotional and psychological toll of constant financial uncertainty. Even those who can keep up with their grocery bills are not spared from the effects of Hawaii's extreme cost of living. The burden of high housing costs, even for those well above the poverty line, is another major contributor to declining mental health. The study found that nearly 40% of working-age adults reported symptoms of depression, an alarming statistic that highlights the growing emotional distress among residents. The weight of trying to survive in an economy where a family of four needs over $107,000 a year for basic expenses is taking a measurable toll, leaving many feeling trapped in a cycle of financial and psychological strain. The situation is worsening. Food insecurity, which had improved slightly after the height of the COVID-19 pandemic, is once again on the rise. Food banks are now seeing a surge in demand similar to crisis levels, with more dual-income families seeking assistance. Families where both parents work but still can't make ends meet. This growing desperation among working households paints a bleak picture of the economic reality in Hawaii. It's no longer just the unemployed or those living below the poverty line who are suffering. It's middle-class families, parents trying to provide for their children, and individuals who never expected to need food assistance. While the study identified certain protective factors, such as stable employment, strong social connections, and safe neighborhoods, these are not solutions to the larger crisis at hand. No amount of emotional support can replace the security of knowing that food and shelter are guaranteed. Policymakers have the power to intervene, but so far, meaningful action has been slow. Addressing job security, improving public safety, and expanding food assistance programs could all help alleviate the crisis. But without aggressive efforts to tackle the root causes of food and housing insecurity, the mental health crisis will only deepen. The warning is clear. Food insecurity is not just about hunger. It is a mental and emotional weight that can break people down, pushing them toward despair. The more families struggle to afford the basics, the more we will see rising rates of depression and even suicidal thoughts among working residents. The cost of living in Hawaii is no longer just an economic issue. It's a public health emergency. Without urgent action, the cycle of financial stress and mental health decline will continue, leaving more and more residents feeling like they are fighting a battle they cannot win.